आप करिए।
This is specimen of kidney. We have two kidneys, right? The kidney is the excretory organ of our body. However, it has functions of excretion. It has function of endocrine function also. It secretes hormones like erythropoietin, renin, right? For side determination of the kidney, now we go for the side determination. So for it, this is right side kidney. Left side kidney. How we will say this is left side kidney? For determining the side, what we do that the upper pole is the broader pole, lower pole is the pointed pole, the convexity should be laterally placed, and the hilum with these the structures, vein, artery, and the pelvis should be medially. So the broader end upward, pointed end downward, convexity lateral, and the hilum medially. In this way, it becomes the left side kidney, right? But in order to say that, in this way also it can be this thing. But what will we say? We will say to exact showing the side determination. In the pelvis, the structures should be, the vein should be most anteriorly, the artery should be in between, and the ureter should be downward and medially, right? In the pelvis, the vein should be anteriorly, artery should be in between, and the ureter should be downward and most posteriorly, right? In this way, it becomes left side kidney, right? If we keep it like this, then the vein will be upward, artery will be in between, and ureter will be downward, but it will become in front. So it should not be that. It should be posteriorly placed. So it should be this one, in this way. So this is the anatomical position of the kidney. Broader end upward, pointed end downward, convexity laterally placed, and in the hilum, vein is upward and anterior, artery is in between, and the ureter is downward and posteriorly placed, and straightly going downward, right? So this is right side kidney. Similarly, this will be the left side kidney with broader end upward, pointed end downward, convexity laterally placed, the hilum medially placed, and with medial placement of the hilum, vein is upward and anterior, artery is in between, and ureter is lowermost and posteriorly placed. So directly it is going downward without tilting, right? So this is right side kidney and this is left side kidney. So right side kidney is slightly lower than left side kidney, right? And upper pole is slightly medially, and this way. So this is the anatomical position of both the kidneys, right? And in this skeleton in the body, the kidney is usually you see that it is extension of the kidney is extends from T12 to L3. So we can say this is number 5, 4, L3, L2, L1, and this is T12. T12, the floating T12 is 12th rib is at the level of T12. So it extends, kidney extends from T12 to L3, right? T12, L1, L2, L3. So this is the position of both the kidneys, like this, right? The location will be in the posterior abdominal wall. Retroperitoneally is a retroperitoneal structure in the posterior abdominal wall and in both sides of the vertebra, right? In the both sides of the vertebra. In the posterior, like this. In the posterior abdominal wall, right? In the posterior abdominal wall, both sides of the vertebra, and the retroperitoneal structure. Peritoneal is in anterior region, right? So this is the side determination. Now what we will do, we shape what in the shape. It is bean shaped structure. Kidney is a bean shaped structure, right? Both the kidneys are bean shaped structure. Size is 11 centimeter in the length, 6 centimeter mediolaterally, and 3 centimeter anteroposteriorly, right? weight, it is 150 grams in the male and 135 grams in the female. 30 to 35, 130 to 135 grams in the female. Location, as I said, it is retroperitoneal structure. It is in the posterior abdominal wall, in the both sides of the vertebral column. Right? Now, the poles. For the external features, in order to explain the external features, pole. It has two poles, upper pole and lower pole. Upper pole is broad, lower pole is pointed. It has two borders. One convex border, lateral border is convex, middle border is concave. Lateral border is convex, middle border is concave. Right? So surfaces. It has two surfaces, anterior surface and the posterior surface. Anterior surface is a little bit irregular and the posterior surface is a little bit smooth and has a marking for the rib. Right? It has a marking for the rib. Right? In the both the is this thing. It has a marking for the rib. Right? So it has two surfaces, anterior surface, posterior surface. Two poles, upper pole, lower pole, two borders, lateral border and middle border. Right? So now the relations of the kidney. In order to explain the relation of the kidney, what we can say, on the anterior surface, it has following structures, on the different structures on the right and the left kidney. In the right kidney, the anterior relation is right suprarenal gland, right lobe of liver, right colic flexor, and here it will be the jejunum, and the lower vein it will be jejunum. So it will be the right suprarenal gland, right lobe of liver, right colic flexor, and right jejunum. In the left side, the anterior structures will be left suprarenal gland, and from the left side it will be stomach, spleen, pancreas at the tip of the pancreas at the hilum, and left colic flexor here, and the left jejunum. Right? Like this. Left suprarenal gland, stomach, pancreas, and left colic flexor, and left jejunum. This is anterior relation. In posterior relation, it has, on the left side, it has two ribs. It has two ribs, 11th and 12th ribs. On the left side, two ribs, 11th and 12th ribs. In the right rib, kidney, it has only 12th rib. Right? And in duodenum, with the duodenum, it has four, with the diaphragm, it has three muscles: Schwanz major, quadratus lumborum, and the transverse abscess abdominis. Okay. With the diaphragm, it has three muscles: Schwanz major, quadratus lumborum, and transversus abdominis. And with nerves on the posterior surface, it has three nerves: subcostal nerve from T12, and subcostal nerve, and iliohypogastric and ilioinguinal nerve. Iliohypogastric and ilioinguinal are the L1 nerves, and the subcostal nerve is the T12 nerve. Right? This is the posterior relation. Now the coverings. To explain the coverings of the liver, covering of the kidney, it has a capsule. Innermost covering is the capsule. Outside this innermost covering is the capsule. Outside capsule is the pre-renal fascia, and then there is a renal fat, pre-renal fat, and then pre-renal fascia, and then pararenal fat. From inner side, outside is renal capsule, then pre-renal fat, then renal fascia, and then pararenal fat. Right? In the fascia, it has two fascias. Anteriorly, the fascia is thick. That is called renal. The two fascia. The anterior fascia is called fascia of Girota. Anterior fascia is called fascia of Girota, and posterior fascia is called fascia of Zuckerkandl. Fascia of Zuckerkandl posterior, and fascia of Girota anterior. Right? In this way, we finished all the structures, relations of the kidney, and this is and for the development part, we explain it in this way. the collecting part develops differently and the secretory part develops differently. The collecting part develops from the ureteric bud, and the secretory part develops from the mesonephric part, that is called the secretory part develops from the mesonephric blastema. The secretory part develops from mesonephric blastema. Right? This way we finish the kidney. Thank you.